working on informality and social protection in Africa, lessons for a post-COVID era, which officially launches a new UNDP study developed in collaboration with ILO and expertise from UEGO on this topic. Dear colleagues, you would agree with me that one key lesson from the COVID-19 pandemic is that the vulnerabilities that we've seen and that are affecting millions of people in the informal economy are really, struggling. Without access to fundamental social protection, excuse me, just trying to get this right. Just apologies, my computer's froze for some reason. I'm back. So I was saying that one key lesson from the COVID-19 pandemic is that it has highlighted the vulnerabilities in the lives and livelihoods of millions of informal workers across Africa. And without access to fundamental social protection that provides the necessary cushioning against shocks, informal daily wage laborers, market vendors, domestic workers, and their families have had very limited access and means to cope with the economic, social, and health impact of the pandemic. Against this background, this panel will present and discuss lessons, strategies, and policies emerging across Africa to extend social protection to the informal economy workers as one of the critical means to build forward better, resilient societies in the post-COVID era. To do so, we'll draw not only on the findings of the study that we're launching today, which is informality and social protection, a forward-looking assessment of contributory schemes. We'll also look at a specific country-level experience, that would be Togo. Also building on perspectives from the employers' organizations and business associations from Kenya, as well as on ILO's and UNDP's approaches to informality in Africa. On this last point, UNDP and ILO partner globally within what they call the Framework for Action to support the UN system-wide socioeconomic response to the COVID-19 crisis, and also to build pathways for an inclusive, sustainable, and resilient recovery. The framework covers 7 collaboration areas, including, but not limited to, social protection, informality and MSMEs, decent jobs for youth, and gender equality. I would like here to acknowledge this partnership. Let me now introduce our distinguished panelists in their order of speaking. First, we'll have Ms. Laura Alfers, she's the Director of Social Protection Program at UEGO, also the lead expert and author of the study that we are discussing today. We'll then have the Honorable Minister, Ms. Miriam Dosud Almeida, Minister in charge of grassroots development, youth, and youth employment with the government of Togo. Then we'll have Ms. Jacqueline Mugo, who's the Executive Director of the Federation of Kenya Employers and Secretary General of Business Africa. Following speaker would be Ms. Cynthia Samuel Olanjuwon, Assistant Director General and Regional Director for Africa with the ILO. Last but not the least, we'll have Mr. Stan Swain, Director of the Regional Service Center for Africa, UNDP. Now, before we start with our deliberation, allow me to make a few announcements. First, each speaker will have 10 minutes to deliver remarks and presentation. Second is that French and English interpretation is available. You have the world share button in the Zoom controlling panel at the bottom of your screen. Please make use of it to toggle from French to English as you see necessary. This session will also be recorded and the link will be shared with participants after the event. Also, for the discussions, make it lively, we encourage you to register your questions in the chat box, and we will try to answer as many as possible. Finally, the link to the report, both in English and French, is available in the chat box. Let me now turn to our first speaker, Ms. Laura Alfers, with this following questions or set of questions. We agree that African governments have made significant efforts to develop a range of contributory social protection schemes. And in that regard, the report provides an overview of these experiences. Now, drawing on the findings of the report, what do you see as being the key opportunities and challenges to the extension of social protection to the informal workers? What innovations and success factors, any issues with the uptake of these programs? And what would be your key takeaways and recommendations and lessons, and whether the COVID-19 might prop up or not the expansion of schemes for informal workers? Ms. Alfers, the floor is yours.
Thank you very much, Mansour, for that introduction and those questions. I suppose I should start by saying that this report was written prior to COVID, and much of the attention on the COVID response has been through social assistance schemes, not through contributory schemes. But it is quite interesting that it's actually through the contributory schemes that many African governments are trying to reach out to informal workers and cover them with social protection. So I think in terms of the longer term questions about the coverage of informal workers post-COVID, the contributory systems are going to be an important focus. And I feel like, in a way, that may have been lost sight of within the sort of COVID discussions last year. So it's good that we're turning our attention back to them. Some of the noteworthy design features, we analyzed seven contributory schemes across Africa, and we picked them for a range of different features. Whether they were designed specifically for informal workers or were adaptations to the main scheme, voluntary or mandatory, so on and so forth. I think some of the noteworthy design features we saw were some real attempts to engage with informal workers and determine their priorities in the benefits packages. And I think in Zambia, for example, the pension scheme, the NAPSA pension scheme, has done some extensive piloting and research work with the support of organizations like the ILO to determine what works to reach certain sectors within the informal economy and to really engage with informal workers about that. And I think that's a very positive development and something that needs to be further institutionalized in the design of schemes. I think we're seeing more and more interesting combinations of benefits, combining short and long-term benefits, and also benefits that are traditionally thought of as social security benefits like pensions and health and workplace injury, with benefits that may not be considered traditional workplace social security benefits, but which are nevertheless really important to informal workers, such as scholarships for children, loans and credit, and so on. And one of the good examples of that was the Joheza long-term savings scheme out of Rwanda, which has an interesting combination of benefits on offer. And I mean, it's important. I mean, the thing about drawing informal workers into contributory schemes is that they need to see what, the point of it. And so the combination of short-term benefits and longer-term benefits is an important one to experiment with. I also think there have been some real advances with digitalization. In the Kenyan, Tunisian, Zambian, and Rwandan cases, which we looked at, all had developed innovative digital marketing strategies, drawn on popular digital technologies, using mobile phones and mobile money, allowing informal workers to register, pay contributions, receive benefits, greater ease of access to check their balances and understand what is actually going on with the money that's being deposited. And I think that's really important. I mean, there is a digital divide, and that is an issue, but it does, for those workers who do have access to technology, it's greater ease of access and can aid in transparency. And so I think those are all really important things that we picked up. I think there were also many issues that are likely to limit access of informal workers to contributory schemes. And I think the biggest is the financing. So one of the big tensions we saw was the trying to integrate self-employed informal workers into existing social security schemes. It's quite hard to change the payment modalities to both fit the irregularity and low level of incomes in the informal economy and the financial sustainability of the scheme and the provision of meaningful benefits to those workers at the same time. And we saw this as a big issue with the National Social Security Fund in Tanzania, where there was a low payment option for informal workers, but the benefits in return were so low that many informal workers didn't see the point. And so this is why you're also seeing the design of separate schemes for informal workers, which are more flexible and work on different principles. So we saw the Empower Pension Scheme in Kenya, the Ejoheza in Rwanda. But these come with their own financing issues as well, because you're losing the risk sharing and social solidarity component of social insurance schemes when you make these separate schemes for informal workers. This is basically informal workers in large respect paying for their own social protection. And this is always going to place limits on how much these schemes can expand, I think. I think linked to this is the need for the inclusion of non-contributory benefits into contributory schemes. Not all informal workers are poor, and we know that there's a range of incomes in the informal economy, but many are. And this is particularly amongst women. We know that 25% of women informal workers in sub-Saharan Africa are contributing family workers. And that's the poorest and most vulnerable form of employment. And compared to 12% of men. This is outside of Southern Africa. So again, there's always going to be a limit to how much contributory schemes can cover people who are contributing family workers. And I think what we saw was that one of the only contributory schemes that's managed to really reach large amounts of people, over 90% of the population, is Rwanda's community-based health insurance scheme. And that has a relatively generous non-contributory component to it. And I think that there is something for national social security schemes to learn from health insurance schemes which have adopted these models of contributory and non-contributory combined benefits. I think gender sensitivity in the design is also a big issue. We did include one scheme, the Akhmini scheme from Tunisia, was an example of a contributory scheme designed particularly with vulnerable women, informal waged workers in mind. But I think there's still a lot to do in this respect. We didn't see a lot of provision for maternity or paternity benefits, parental leave. We didn't see much to say that contributory schemes were taking into account women's interrupted contributory capacities due to care. If we look at Latin America, there are many examples of where things like care credits have been instituted and might be used as examples in the African context as well. And I think particularly in this COVID context, we have to see the expansion of contributory schemes as part of a wider package to ensure that informal workers' incomes are improving. Because the only way we're really going to be able to expand the coverage of contributory schemes is if people's contributory capacities increase at the same time. And so the integration of social protection with wider support packages around livelihood development, access to markets, etc., is important. And I think separating off social protection from those wider economic policy issues will be detrimental to this agenda. And then finally, the idea of participation. I mean, I mentioned it in relation to the Zambian example, where they have made a very concerted effort to include organizations of informal workers in designing and discussing schemes around the pension reform. I think that's an excellent model. We're not seeing it enough. I think. Informal worker organizations, if they are going to be consulted, it's usually through an alliance with a formal trade union, but are not necessarily consulted directly. And I think that creating spaces for direct representation of informal workers should be a priority. And also just to say that many of the schemes we looked at were relatively new, so it's still hard to know what the impact is going to be. But I hope that, you know, data collection, there are many innovations which are taking place that are positive, and I hope that that data will be more available in the coming years. Thank you.
Thank you so much, Laura. And may I please invite colleagues who are not speaking to please mute their microphones. We're hearing some of you speaking. Thanks so much, Laura. So I guess we have this understanding that you know, we should be muted. Thanks so much. I think this is an excellent overview of the recent experiences based on the 7 studies and analysis featured in the report. I just would like to highlight a number of issues that you picked on and which for me are critical. First is the combination of short and long-term benefits. I think this is really important because we'll be also looking at empowering, right? Second is digitalization, an enabler, but yet a challenge because of the digital divide. And this, of course, can be, you know, amplifying inequalities is not properly addressed. Third is financing. I think this, of course, is the key issue here that needs to be addressed. Gender sensitivity, also very important. I hear from your report that, you know, this has been tackled in a very limited way. So more effort needs to be done to improve, you know, gender sensitivity. Also, inequality-wise, of course, this has to be part of a larger package, really, because what we need also is to see people's income grow. And here we're speaking of, you know, income inequality that needs to be addressed to make sure that we have, you know, an efficient way of addressing this system globally. And finally, is this space, this dialogue base, they need to be empowered to raise, you know, their voice in the informal sector. Those are very powerful takeaway messages that I would like to highlight. Now, let me now turn to our country case study. And you're all aware that in Togo, we have this very successful program that's called Novisi. So Honorable Minister Miriam Dossou Almeida, taking into account Togo's experience with extending health insurance to informal economy workers and vulnerable groups, what are the lessons learned? And how has COVID-19 impacted those efforts? Over to you, Minister.
Merci, Monsieur Mansour Diaye. Bonjour à tout le monde. Je suis honorée de pouvoir contribuer donc à cette réflexion globale sur la protection sociale. Et vous connaissez certainement pas tous le Togo, petit pays en Afrique de l'Ouest, avec une population d'à peu près 7,7 millions d'habitants. Un pays où la protection sociale s'envisage dans... Un instant, je vais mettre la vidéo, merci. Et donc, au Togo, un pays où la protection sociale est envisagée dans le cadre plus élargi de la relation entre employeurs et employés, avec différents mécanismes qui permettent de réduire la vulnérabilité et la pauvreté. On y trouve des mécanismes contributifs aux côtés de mécanismes non contributifs qui sont portés par différents acteurs et différents ministères et pour des cibles également variées. Ce qu'il faut savoir aujourd'hui, c'est que la protection sociale, globalement au Togo, en termes de régime contributif, couvre la pension, la retraite, les accidents de travail, la maternité, à la fois pour le secteur privé et pour le secteur public, avec 2 caisses différentes. Et l'assurance maladie INAM, que je représente ici aussi, a été créée en 2011 pour couvrir les risques maladies, prioritairement des fonctionnaires, des agents publics, civils, militaires, actifs et retraités, avec leurs ayants droit. Donc, on a une famille de 6 membres avec des options d'extension. Aujourd'hui, avec ces différents mécanismes, on a des cibles qui sont adressées. Il est important, effectivement, de planter le décor pour qu'on puisse comprendre qu'est-ce qu'il y a, comment s'inscrit la couverture de l'informel dans tout ce décor-là. Et c'était très important parce qu'on a un puzzle qu'on est en train de constituer progressivement dans une stratégie plutôt intégrée et cohérente. Et donc, on a une cible de personnes, de population en âge de travailler. On a une cible donc d'actifs et une cible de retraités, mais aussi une cible de vulnérables. À côté de ces cibles, on couvre également, on offre une couverture de protection sociale aux femmes et aux enfants. Je donnerai le détail de tout ça, ce qui permet d'avoir quand même un périmètre assez diversifié et de répondre prioritairement aux besoins de protection des populations. Ce que j'aime dire le plus souvent, c'est que les besoins sociaux des populations dans nos pays ne sont pas forcément identiques aux besoins qui ont été à l'origine de la création des modèles de protection sociale. Et cependant, le cadre de la Convention 102 permet quand même de dérouler aujourd'hui une protection un peu plus élargie, avec, sur la base du socle. Alors, des solutions, donc, avec différents acteurs, l'Agence de développement à la base et des appuis multiformes des bailleurs de fonds, des partenaires techniques et financiers comme le PNUD, on a la Banque mondiale, l'UNFP, permet de juguler donc la question de la régression de la vulnérabilité, de la pauvreté. Spécifiquement, on va venir maintenant à l'INAM dans ce contexte-là, qui est une institution légale qui a été créée donc pour développer un savoir-faire en assurance maladie, ce qui constituait une première expérience pour le pays. Alors, ça a permis de développer et d'expérimenter à échelle, je dirais in vivo, l'utilisation du tiers payant en assurance comme mécanisme de prise en charge et mécanisme de régression des freins à l'accès à la santé. Les agents publics ont été prioritaires avec leurs familles. À partir de cet instant où les process ont été éprouvés, qu'une organisation est mise en place avec un renforcement de capacité des différents acteurs, ce qui nous donne aujourd'hui une certaine légitimité, je dirais, à l'INAM et à toute l'équipe de pouvoir aborder avec sérénité toutes les initiatives d'extension de l'assurance maladie. Le premier groupe cible donc, a avoir été formellement intégré à cette couverture qui, à la base, était adressé aux agents publics, a été le groupe des artisans. Alors, comment nous avons procédé? Il existe un ministère en charge des artisans. C'était le ministère du Développement à la base, à l'époque, que j'occupe aujourd'hui. Et ce ministère, à travers l'installation des chambres de métiers, qui sont des organismes professionnels des corporations qui regroupent les différents métiers, qui, pour la plupart, sont dans l'informel, donc a signé une convention avec l'INAM. Dans le cadre de cette convention, cela a été facile parce que l'INAM est conventionné également à une relation avec l'ensemble des centres de soins, ce qu'il est important de noter, et sur toute l'étendue du territoire, les centres de soins publics, et puis on couvre à peu près 70% des centres privés. Alors, ce contrat entre les centres de soins pour le tiers payant a été juste mis à disposition pour régler et prendre en charge les artisans dans le cadre de la convention. L'un des volets importants donc, de la mise en place d'un tel mécanisme, ce n'est pas tant la prise en charge par le système de soins, mais c'est surtout d'avoir un panier de soins attractif et de mettre en place un mécanisme de cotisation et de mobilisation des ressources assez efficace, qui s'adapte aux populations cibles. Dans le cadre des artisans, effectivement, pour plus de prudence, nous avons commencé avec une cotisation annuelle, ce qui a constitué quand même une petite difficulté pour ces acteurs. Donc, c'est en 2019 que la convention a été signée. Et dès que la convention a été signée, les chambres de métier étaient en devoir de déclarer et de collaborer avec l'institution pour s'assurer que les membres qui étaient enrôlés dans le cadre de ce programme-là étaient des artisans qui étaient plus ou moins formalisés dans la mesure où ils avaient au moins une reconnaissance professionnelle à partir de la chambre de métier. C'est vrai que le premier frein à cela a été la Covid. Quand la Covid est arrivée, le mécanisme de mobilisation et d'enrôlement qu'on avait mis en place a pris un petit coup dû aux mesures barrières qui avaient été instaurées avec une certaine un cloisonnement des villes pour éviter la propagation. Donc, les mouvements étaient limités et cela n'a pas permis un enrôlement à grande échelle comme on l'avait imaginé, parce que c'est quelque chose qu'on faisait commune par commune. Il faut savoir qu'il y a différentes initiatives donc, qui facilitent ce travail-là de prise en charge, parce que depuis pratiquement 2 ans, le Togo a une décentralisation qui est effective, avec à peu près 150 communes, on va dire, et ce qui permet en fait une bonne segmentation pour avoir accès ou enrôler les acteurs de l'artisanat. Le paiement se fait soit par dépôt sur nos comptes à travers le réseau de la Poste ou par paiement direct dans les bureaux de l'INAM. Il est également prévu un mécanisme par Flouz et Timoni qui sont des paiements mobiles. Il est aujourd'hui, après cette expérience-là, prévu dans le projet, c'est un projet qui est mené avec d'ailleurs la contribution du PNUD, que nous remercions donc à l'occasion, de mettre en place, de tester en live un mécanisme de recouvrement des créances et à travers les technologies de l'information. Étant donc en droite ligne avec la planification stratégique de l'INAM en termes d'organisation, de méthodes et d'outils, ce mécanisme va permettre, à travers une organisation des artisans et des acteurs de l'informel, en groupe de tontines ou petites en association, parce que certaines existent déjà. Nous avons eu à travailler avec l'association des commerçantes, qui sont des femmes des différents marchés. La première phase qui est très importante, c'est la communication et la sensibilisation. Donc, il faut dire aux gens ce qu'on fait. Il faut leur présenter le panier de soins et expliquer pourquoi ce panier de soins, en quoi il correspond en fait à une réponse efficiente pour la majorité de la population et qu'il n'est pas fait pour répondre à des problèmes spécifiques, mais à un ensemble de pathologies auxquelles une bonne partie de la population donc, est exposée. Et la deuxième chose qu'il faut leur expliquer, c'est que la santé a un coût, qui sont des acteurs économiques. Et nous savons tous que dans nos marchés en Afrique, du moins pour ceux qui connaissent un peu l'Afrique, regorgent vraiment d'acteurs économiques d'influence et qui ont une surface, je dirais, financière confortable. Et donc, avec ces dames du marché, les femmes du marché, les commerçantes, il y a un accord cadre qui est en cours de finalisation, mais un premier groupe déjà d'associations de femmes commerçantes a été conventionné et ils ont commencé donc à partir de ce groupe-là à mobiliser les ressources pour pouvoir contribuer collectivement. L'une des difficultés aussi qu'on rencontre avec le secteur informel, c'est l'équité contributive. L'équité contributive, parce que quand vous voyez dans l'informel, il y a des gens qui gagnent 100 francs par jour et il y a des gens qui gagnent 200 000 par jour. Donc, ce secteur dit informel, où on trouve des acteurs de différentes natures, a aussi une institution qui s'appelle la délégation à l'organisation du secteur informel, qui est un département qui est rattaché à la présidence et qui a pour mission donc d'accompagner ces commerçants et ces acteurs de l'informel pour qu'ils se formalisent, en sachant que l'assurance maladie est un levier important donc pour cette formalisation. Et dès lors que les populations togolaises ont pu voir l'impact et le bienfait donc, de l'assurance maladie sur les bénéficiaires actuels, le travail est devenu facile. On a plus de la demande et tout le monde a envie d'être affilié ou de bénéficier de l'INAM. Au-delà donc des acteurs de l'informel dont je viens de parler et l'expérience des artisans qui a également permis de voir que l'organisation et la structure même des acteurs peut constituer un frein, peut constituer une cause d'échec de ces mécanismes-là. Au Togo, la Chambre des métiers se retrouve souvent en opposition, je dirais, de point de vue ou en rivalité avec les syndicats. Parce que ces acteurs de l'artisanat ont vraiment aussi des unions, des organisations syndicales qui sont très fortes et qui existaient bien avant l'organisation administrative à travers les chambres de métiers. Donc, c'est des points sur...
Je vous remercie. Ce que vous expliquez est extrêmement intéressant. Je crains qu'on n'aurait pas le temps certainement d'aller au bout. Pouvez-vous peut-être conclure? On va voir avec les questions. Je pense qu'on pourra encore approfondir un peu plus l'exposé. Je vous remercie.
OK, très bien. Donc, pour vous dire qu'aujourd'hui, le Togo dispose d'un organisme qui est spécialisé dans le tiers payant, dans la mise en œuvre de l'assurance maladie. Les populations vulnérables donc, ont également leurs solutions avec différents mécanismes et l'assurance maladie prévoit de les prendre en charge à travers un financement qui existait auparavant et qui était affecté au centre de soins. Donc, en gros, l'informel est peut-être difficile, mais dès lors qu'on a une couverture, un panier de soins intéressant, qu'on a des acteurs qui inspirent confiance, il est possible de mettre en place des mécanismes qui permettent de les prendre en charge efficacement. La digitalisation étant un outil, un facteur important de réussite dans ce type d'initiative. Merci pour votre attention. Je sais que vous parlez de protection sociale du Togo, de l'assurance maladie. On y passerait des jours et des jours parce que nous avons des choses très intéressantes à partager. Je vous remercie.
Absolument. Je vous remercie vraiment beaucoup, Madame la Ministre. Je crois que, colleagues, this was very insightful. I think this is a concrete, case study where we have a lot to learn from. And, very few, takeaways that I would just like to highlight and we continue the conversation later on is that, they managed to address both coverage and comprehensiveness issues by really going beyond, what the social protection floors recommend. And this was done using a very innovative approach, building, on mobile technology, the fee collection mechanism, really digitalization, and targeting two key set of informal actors. First are the art and crafts workers, and now they're also working with women's associations, which are really, very powerful, but yet still facing some organizational challenges and issues that works as a bottleneck to, reaching out to them. Thanks so much, Madam Minister. This was extremely useful. You will agree with me, colleagues, that employers, employees, self-employed persons, and business community are key stakeholders when it comes to the design and uptake of the contributory scheme. So, Ms. Jacqueline Mugo, could you chime in on this from this perspective in terms of what is the role of the state and the private sector in the provision of social protection to informal workers? What are the barriers to a greater uptake? Are these schemes really addressing the needs of the informal workers, including women? And what are the lessons from the COVID-19 pandemic that need to be considered? Over to you, Ms. Mugo.
Thank you, Mr. Ndiaye. My name is Stephen Obiro. I'm holding in for Ms. Jacqueline Mugo. She's just been caught up in some emergency and she's not able to join in time. And I'm the head of policy advocacy and communication and partnerships. And so Ms. Jacqueline Mugo first sends her greetings to the delegates, to you, and she's very excited that we are having this conversation. Looking at the contributory schemes and from the perspective of employers, employees, and the question of informality and social protection in Africa, we have various lessons. And when you look at the role of the state, you go back to the key guiding principles, the legal instruments that we have. If you look at the Universal Declaration of Human Rights in 1948, Article 22, requires that everyone as a member of a society has the right to social security. If you look at the International Convention on Economic and Social Cultural Rights, Article 9, it requires that the state parties to present covenant and recognize the right of everyone to social security, including the social insurance. And if you look at the African Charter on Human and People's Rights of 1981, and you look at Article 16, the right to health, and Article 18.4, the right of the aged and disabled to special measures of protection, and you look at the various the ILO conventions and recommendations on social protection, example being Convention 102 on minimum standards of social security, and Convention 121 on employment injury benefit, and Convention 183 on maternity income protection, and Recommendation 202 on social protection flows. And an example, if I come home to Kenya, the right to social security is enshrined in the Constitution. Our Constitution, if you look at Article 43, every person has a right to social security. The state, and it requires the state to provide appropriate social security to persons who are unable to support themselves and their dependents. However, these rights is to be progressively realized. That's what our Constitution in Article 21 says. Now, what does all this tell us? One is that the state has an obligation to ensure that everyone has social protection, and which should be in line with the ILO recommendation 202 on social protection flows, which calls for the granting access to essential healthcare and minimum income security for all. And the state should therefore ensure that no person falls below the floor to uphold the dignity of all persons. And it should also promote inclusive growth, enabling the state to tackle inequalities. And prioritization on social protection issues is key in achieving social justice. Now, if you look at the world, if I may just quote Joan Somaya, the former Director General of the ILO, he observed that the world does not lack the resources to eradicate poverty. It lacks the right priorities. And that is true even for Africa. If you look at Africa, for example, look at our arable land. 60% of our land is arable. Look at the 90% of all the raw materials are from Africa. 40% of various minerals like gold reserves are in Africa. 3 are diamond reserves in Africa. 80% of coltan are in Africa. And you look at that, we have the resources we have, and even the amount of land we have is enough for us to eradicate poverty and to provide the social protection that we need. Now, the state has to prioritize social protection and indeed universal social protection as it creates an economic stimulus, which ejects back to the tax base, thereby stimulating the overall deployment, which contributes to the sustainable development. And so what we need, like for example, in Africa, is to prioritize and put the resources into good use and ensure that the people are able to benefit directly. Now, if you look at the state, it also needs to create an enabling environment for the private sector to operate and thrive. And if the private sector operates and thrive, then there will be business growth and ensure that there is job and wealth creation, particularly in Africa. And this will be able to address the growing youth bulge, which many of them are unemployed. And so we need to see Africa capitalizing on this demographic dividend to have the sustained development. It is also the duty of the state to provide a political capital and ensure that the right regulatory framework is there to ensure proper administration of social security. And this can be in the form of establishing competent boards and having legislations in parliament that govern those boards. And this will prevent cases of abuse of office by the administrators of social security funds, and also ensure a checks and balances mechanism where responsible parliamentary committees keep social security management in checks. And in addition, political goodwill, to political goodwill, the government has a role to play in providing the required financial services to make social protection programs work. We know Africa is largely informal, and for that we need the government to come in very strongly and be able to mobilize resources and ensure that the informal sector workers are able to be covered, and also to give that civic education that is required to inform them on the various decisions that they make as far as informal sector workers are concerned, and also to help ensure that there is a business compliance, the private business are able to comply. Now, when I look at the private sector, one of the key things I look at is all these resources, the government to be able to do what it has to do, then they need resources, and these resources comes from the tax revenue. So the obligation of the private sector is to ensure that they pay the tax, they meet their tax obligations, and they also help in the remittance. When you look at the contributory schemes, they help in the remittance for the contributory social security programs, and also this one, and also they ensure that they support where they can, and this will ensure that there is enhanced social security social protection coverage. Now, the private sector has also a key role in governance of the social protection programs, because it can provide a core competency in ensuring efficient and effective delivery of systems for social protection. In addition, the private sector the employers can play an oversight of the social protection institutions and be able to ensure that the decisions that are being made, they have their input and the right decisions. And so the representation of the employers in decision making becomes very important. Now, and the corporate, if you look at also the private sector, they can also have the social insurance programs, and thereby they reduce the employer liability by covering different contingencies. And also when they carry out their corporate responsibility program, then they become complementary. Now, if you look at the barrier on the uptake of the existing schemes, we have various barriers, some of them legal. If the environment is not adapted to the changing work, if the legal, the laws, we have the financial barriers. If you look at the low incomes, irregular incomes, and employment, and then these are all barriers. And sometimes if you look at it from the employers and even from the workers, if we have small multiple deductions, they become huge deductions, and it becomes a barrier to social protection. Other barriers are administrative or barriers or institutional barriers. And this looks at the processes of even registering businesses with the schemes and remitting the deductions and the high transaction costs that are involved if we have multiple deductions. As an example, in Kenya now, what they're doing, we are having a unified payroll return system that is being put in place to ensure that we reduce on the administrative costs of this transaction. Now,
Mr. Obiro, may I please ask you just to take a minute or two to wrap up? I'm unfortunately out of time. Thanks so much for your understanding.
Okay, thank you. So, if the other issue perhaps I want to highlight is that there can be lack of appreciation on the realities that exist on the ground. If we model our contributory schemes, we have to appreciate that in Africa, over 90% say of workers are in the informal sector. So they have to be provided with an avenue. We can't come in with only a formal mindset and think that we are going to cover them. Thank you, sir.
Thank you so much. That was very, very useful. Very interesting insights. And definitely I take, I would say, just three key issues. First is that what we're discussing is basically a human rights issue. Second, that the state has the responsibility to create an enabling environment for the private sector, but also for the private sector to meet its tax obligations. And then, of course, for the public sector to put the resources to good use, taking, of course, all the administrative and institutional challenges that have to be addressed. Thanks so much. That was really very useful. Thanks for your insights. Let me now turn to our partners at ILO, Ms. Cynthia Samuel Olonjuwon. ILO has been a key agency that advocates for social protection for all. What would be your take on the key issues around the inclusion of informal workers and ILO's work in this respect in Africa? And also, could you elaborate on how this work has evolved over the years and most recently as a result of the COVID-19? Over to you, Ms. Olonjuwon. Thanks so much.
Thank you very much, moderator, and good afternoon to everybody. Good morning, depending on where you are. Learning from the other panelists, and I know how passionate I am on social protection. Once I start talking, I will go on and on. So permit me to just focus by reading a statement that I have prepared because it answers those questions rather than allowing me to do what I normally do, which is talk passionately, and I'll take another 1 hour. Is that okay with you?
That works. Thanks so much.
Excellent. And I can assure you I'll do this in 10 minutes. First, it's important, like you rightly said, to acknowledge that we do have a partnership with the UNDP, not only at the global level, but we also have it at the continental level. And this partnership is so important around the issues we're discussing right now, which is on social protection and the informal economy, because we agreed within the context of that partnership to focus on 3 areas: social protection, extension, informal economy, formalization, and addressing youth issues. So this conversation and the report that we are launching today is bang within the context of putting into practice what we have said. So we're moving from talk to walking. And it's also very important in our joint ability or bringing our joint resources to support the continent's structural transformation, as well as facilitating a resilient recovery. So it's good to just put this at the beginning. Universal social protection throughout the life cycle is essential if we want to realize human rights to social security for all, advance social justice, promote inclusive growth, accelerate progress towards the achievement of the SDGs. In fact, I make bold to say that if we do not address the issue of social protection and the informal economy in Africa, Africa will not meet the SDGs. We're pleased that many countries have developed policies aimed at promoting social protection. And many of these countries, and I think that was referenced by our colleague from FKE, have this even enshrined in the Constitution. In addition to what is happening at the national level, we do have the African Union also have relevant frameworks, and I'll just focus on one, which is very pertinent, and that is the AU Social Protection Plan for the Informal Economy and Rural Workers, which is called SpireWorks. This is very, very important in terms of demonstrating the continent's understanding that you can't really have the kind of inclusive and equitable growth that we want in the continent if we do not address social protection, as well as particularly focusing on the informal economy. In addition to this, and I won't repeat what was said by our colleague from the FKE, the 2019 Abidjan Declaration, which was adopted by ministers and very high-level representatives of business and workers, made one very important recommendation, and that is sustainable social protection coverage in Africa must be extended. And so for us in the ILO, this is matching orders, and that's what we're working on. So in spite of all the good work in terms of policies, even in terms of the Constitution and the AU, we find that social protection coverage in Africa is the lowest in the world. We're talking about 17.8. And this in and of itself is horrible. But when we look at the global context, where the global average is 45%, it means that we do have a lot of work to do in Africa. The COVID pandemic has exacerbated the situation. It has exposed the glaring gaps in social protection. It's underscored the importance as well as the consequences of insufficient coverage, particularly in the informal economy. And so this is quite key, and many of the previous speakers have talked about the high levels of informality in Africa. Our studies show that at least 8 out of every 10 workers in Africa works in the informal economy or does informal work. And there are barriers to the coverage of workers in the informal economy, including legal coverage, and I emphasize that. There are issues relating to legal coverage, there are issues relating to financing and administrative processes. Working in the informal economy and extending social protection coverage to the informal economy, and this relates to what are we doing different, means that we have to work, we have to think differently. It can't be business as usual. We have to program differently. We have to work differently. In what are these areas that we have to work differently, building on, of course, what the ILO has done over the years? And these include the normative work, which was referenced on the conventions. Convention 102 was mentioned, Recommendation 202 was mentioned. What was not mentioned by previous speakers is Recommendation 204 on the formalization of the informal economy. And that is where we now see change in how we work. One of the key things is that we have to work in a multi-sectoral, multi-dimensional manner. We can no longer work in silos. We've worked in silos all these years, and that's why, despite all that is happening in the continent, we're not having the kind of results that we need to have. So working in a multi-dimensional, multi-sectoral manner is a key part of doing things differently. Another thing is in terms of the partnerships. We know that UNDP has been working on social protection, ILO has been working on social protection, UNICEF has been working on social protection, the World Bank. But what needs to change for us to have the kind of impacts that we want to have is that we have to work together. We have to bring our expertise, we have to bring our resources together, we have to work as one, and thereby mobilize the partnerships nationally so that ministries of finance, ministries of labor, ministries responsible for social affairs will work as a coherent team. And then we need to put into practice this policy coherence that we've talked about, and which we haven't done very well. And that's why we're so excited with this partnership with the UNDP as well as with the World Bank. In addition to the normative framework, the ILO has engaged in practical work to support member states through the development of effective tools. One of the tools I mentioned is the one that was developed in 2019. Yes, we have the conventions, we have the recommendations, but these have to be packaged in a way that member states can now translate what is in those instruments to concrete work. And that's what the ILO guidebook on extending social security to workers in the informal economy, lessons from international experience does. Another one that we have done, which is part of the new way of working, is in partnership with other institutions, notably the UNDP, and we've developed Transform. Transform is a very practical way of helping member states really translate the social protection flow into concrete reality at the national level, or even at lower levels, that subnational levels. We're also working, of course, on research, and this is helping to guide member states, inspire member states to be able to do what it is that they want to do through their policy instruments, or which they've not been able to do. As I round up, this is 2021. It is absolutely unacceptable that social protection is still being discussed at the level we're discussing it. It's unacceptable that Africa has only 17.8% of her population covered. And that is why the ILO in Africa, and working very closely with its new partners, has embarked on a bold and very ambitious program. And this strategy is geared towards ensuring that by the year 2025, social protection coverage in Africa moves from the current 17.8, which is less than 18%, to 40%. It is ambitious, it is bold, it is going to task us, it's going to ensure that we put our monies where our mouths are, but it can be done. And some of this, the components of the strategy include the redefinition of partnerships, reviewing of partnerships. in ensuring that we work in a coherent manner in support of our member states. So it's no longer silos. A second part of the partnership is we need to move from ad hoc interventions, cash transfers. They're useful in certain instances, but we need to move beyond them to creating systems and structures that will bring about the kind of sustainable interventions that are required, particularly in the informal economy. We're also looking at statistics, investing in statistics, not just having surveys, but helping to develop statistical capacities in the countries of Africa so that they're able to generate on a regular basis policy relevant, timely data that they would be able to analyze and use to inform both policy formulation and policy monitoring. In addition to this, it is very important, and I'll end there, to identify some of those key areas that we're working with to support member states, but which has to be taken on board as part of a universal package. And that is that we need to agree and understand that the extension of coverage of workers, of social protection coverage to workers in the informal economy has to be comprehensive, has to be integrated within the context of the national social protection strategy, and should be led by the government and built around certain fundamental principles, and I'll end there. And these principles are universality of protection, adequacy and predictability of benefits, financial sustainability, non-discrimination, sound administration, as well as tripartite participation. A lot of these will require different stakeholders to come together. The era where Ministry of Finance does its own thing, Ministry of Labor does its own thing, other ministries do their thing, that cannot take us to where we need to go. And that's why we're really very excited that with the World Bank, with the UNDP, and with other stakeholders, we're moving out of business as usual into a more integrated, into a more comprehensive, and a more targeted and practical support that will make sure that by 2025, we will have that 40% coverage. Thank you very much. I'll stop here.
Thank you so much. This is very much appreciated, and trust me, taking us through your statement didn't prevent the passion to flow. So we felt the passion, and really thanks so much. This is very much appreciated. Just a few takeaways from your statement. It's going to be difficult, of course, to summarize this, but just a few points. First, I would say what I take from your statement is just that we have unprecedented challenges ahead of us. So we need business as usual, unprecedented response to it. First, no SDGs inside without universal social protection. That's a critical piece of it. Second is that we need to extend sustainable social protection. Agree, 17% people covered is too low. That's really a challenge that needs to be addressed. And how to do it is about breaking the silos. We need to get into systems thinking, all of society approaches, where we really connect the dot, put our energies, our resources, our expertise together to really, walk the talk like you were saying. And this also touches on building capacity along several, areas, but including data and statistics. Fully agree that's critical to inform policy design. And this, of course, will require broad partnerships. I would say redefine partnerships, really to bring our expertise together, not only to support, but also to inspire member states with concrete example that works. One of the speakers earlier mentioned the case of Rwanda. That's just great. 90% of the people covered in the informal sector. Those are the kind of results we would love to approach. So agree that we need to raise our ambition. 40%, that's the first step, but I think moving forward, we could even look at beyond that. So thanks so much. This was very, very, very much appreciated. Let me now turn to Stan Swain from UNDP. Dear Stan, could you please reflect on UNDP's approach to informality and social protection in Africa? And what do you consider as important for the post-COVID-19 era? Stan, over to you.
Thank you very much, Mansour, and Thanks very much to my sister, Cynthia. Greetings from her colleague on the UNDP side, Ahuna Jakonwa, the UNDP Africa Director, who is presently traveling in East Africa and so couldn't make it today. She is also a very passionate advocate of the informal sector and of social protection. And I'm very sure that the passion of these two women is going to drive us both on the UNDP and ILO side in this partnership. We go to go as far as possible. UNDP's journey into informality and social protection efforts actually began long before the COVID-19 pandemic struck in Africa. And the pandemic has mainly highlighted the importance of these efforts, bringing these efforts to center stage as events and efforts have unfolded. The informal sector, as we all know, has consistently been somewhat of an anomaly in the region, while informal employment is by far the main source of income and employment in Africa, accounting for nearly 86% of all forms of employment. This significant population of Africa is often found to be living on the edge, highly vulnerable, very poor, low earnings, irregular incomes. Informal workers continue to not be covered. They're still not covered by social insurance, which is only available to the few workers in the formal sector, or by social assistance, which is delivered mainly to those in extreme poverty and in conditions of specific vulnerability, such as persons with disabilities. Informal micro enterprises and livelihoods are characterized by high precariousness and low productivity. Yet, despite the various vulnerabilities faced by informal workers, the story of the sub-Saharan African informal economy has not just been one of poverty and vulnerability. Indeed, in sub-Saharan Africa, excluding, of course, South Africa, informal workers and the informal economy have managed to be dynamic and to make significant contributions, sometimes in the range of 20 to 50% of the non-agricultural GDP, besides being the predominant employer, particularly for women and young people. Together with our partners in this exercise, we believe there has to be a role for an integrated social protection approach to harness the contribution of the informal economy, in part by providing social protection and by strengthening productive capacities, building on the tremendous potential that exists in the informal economy. We believe that when combined, these two elements can best address poverty and vulnerability of insecure livelihoods and incomes. It is in the midst of these reflections that the COVID-19 crisis hit the African continent. The UN Secretary General, as part of its comprehensive offer of prevention and recovery support to developing countries, asked UNDP to act as a technical lead for the socio-economic response and recovery from the pandemic. Soon after that, the UNDP Regional Bureau for Africa began assisting African governments with the immediate response to the pandemic, with support of other parts of UNDP, of course, consisting of addressing the immediate health needs, as well as generating the evidence needed to assess the socio-economic impacts at the country and regional levels as a basis for designing more effective national recovery plans. Although African governments' initial policy measures were focused heavily on the formal economy, such as airlines and other structures in the formal sector, it was clear that new and unique areas were emerging, namely recognizing that the informal economy is inextricably linked to and impacts directly on the formal economy, and for that matter, the entire population in African countries. This recognition was reinforced by the social impact assessments that UNDP helped countries to undertake in Africa. For example, the World Bank estimates that 27 million people in sub-Saharan Africa are likely to be pushed into extreme poverty, and that GDP growth was expected to fall from 2.4% to minus 2.1% and minus 5.1% in 2020, while the Economic Commission for Africa estimated that nearly 20 million jobs were likely to be lost in the region. National level socioeconomic impacts of the informal economy carried out by UNDP in those countries revealed further evidence of negative impacts exacerbated by containment measures, the economic contraction, and resultant loss of livelihoods and growth. As UNDP has transitioned from the immediate response and evidence gathering phase, our attention has turned to supporting implementation of national recovery plans. At this point, issues around the informal economy have moved to the forefront of the national recovery efforts. Indeed, most African countries have introduced temporary social protection measures, such as cash transfers, subsidies, fee waivers, etc., to compensate for the lost incomes of the most vulnerable populations, including in the informal economy, and as a counter-cyclical function to help stabilize economies. In parallel, we also have seen actions to support micro, small, and medium-sized enterprises to recover by strengthening their productive capacities. This is certainly a promising start and direction in Africa. However, more needs to be done if the continent wishes to build forward better and to ensure itself a more resilient future. COVID-19 recovery efforts by African governments needs to go beyond the immediate support to develop mechanisms and systems that will place the informal economy on a pathway to structural transformation. In other words, there is a need for integrated social protection efforts for the post-COVID era to build on the political will and actions by African governments. The integrated approach is meant to overcome often siloed approaches to the varied needs of informal workers so that they can climb out of poverty and vulnerability. It means ensuring that social protection goes beyond temporary cash injection to affected households when crises hit. We can build on the good practices and innovations that have been presented here today. Togo, Kenya, Rwanda, Ghana, and other countries that have very good practices that we can learn from to close the social protection gap of informal workers by helping countries institute flexible contributory schemes or subsidies for those who cannot afford to pay. It also means, finally, economic empowerment that will increase the productivity levels of casual informal workers and enterprises for a more resilient and prosperous Africa. I'd like to thank our partners again at ILO and WIGO, and we at UNDP look forward to our continued engagement and partnership with African governments and our collaboration with other partners to make these aspirations possible. Thank you very much. Back to you.
Thank you so much, Stan. That was very useful and very rich. I'll just focus on 2 points that you highlighted. First being the need to combine both social protection, meaning the protection angle, but also an empowering angle by working on productive capacities and building those to make sure that by combining them, there is a very good livelihood of addressing both poverty and inequality challenges. But also the need to look beyond the immediate response to build on best practices, what works elsewhere. No need to reinvent the wheel. But then to really look toward 2030, look at how to grow, in a resilient, sustainable, and green, manner. Thanks so much, Stan. That was very useful. I'm looking at my watch. We only have 5 minutes left, but I would really like to have some discussion with the floor. I see a couple of questions here. Very specifically, I'll read those questions, and then for those of the panel members that didn't have a question, I'll just offer an opportunity to say some concluding remarks. So for Ms. Alfers, we have a question from Mauritius, which is how to outreach those in informal sector who are not on existing list database. That is basically the missing middle. Any country experience about such a database that you could share? Then for Ms. Olonjuwon from ILO, the question is that partnerships and coordination are key. How can country officers and country representatives create an effective collaboration with World Bank, ILO for social protection, technical support at the national level. This, of course, includes, you know, the UNDP partnership. Any advice that you could share for a specific model to follow for an easy engagement and deployment? This is basically how can we better connect, broaden the partnerships, join forces to address the social protection challenge. And then I would just invite the rest of the members of the panel to just share their final perspective. So maybe over to Ms. Alfers.
Thank you. I won't be very long. I'm putting a link into the chat right now, and it will take you to a document put together by what is called SPACE, the Social Protection Alternatives for COVID-19 Expert Advice Helpline, which is a sort of group of experts, social protection experts, constituted by the ex-DFID and GIZ, bilateral donor organizations. And I think it's an excellent document because it really gives an overview of how governments have tried practically to reach people in the informal economy, in the missing middle, who are not in existing databases. And it gives a great overview of ways that this can be done. So I'm going to leave it at that. And I think it's a really useful resource for people to look at in terms of how practically governments have tried to reach this group of people. Thanks.
Thanks so much. Maybe now turn to the ILO.
Thank you very much for the question. I know my colleagues will provide additional information in terms of how to engage. What we've done, and you said that very well, Ms. Soro, that we're redefining partnerships. And right now we're having very good conversations in addition to what we're doing with UNDP, and I think you can answer that just as well as I can. But let me focus on the World Bank partnership, where we've agreed that we will work on social protection and a couple of other areas, and we've identified 5 countries where we will do the initial work, where there will be the kind of policy coherence that we're talking about. In these 5 countries are Namibia, Mauritania, Senegal, Kenya, and Cote d'Ivoire. So those ones are already earmarked. We will work together. So for those who are from those countries, it's already in the bag. But in addition to that, what we agreed upon is that we will support countries that are doing their country strategy preparation, so that that coherence is already integrated. So that's a second level. So for those countries where that is already on the card, there's already a platform, a framework for us to engage. The third one, if the country involved is not one of this, is really to bring this up within the context of the conversations on social protection at the UN coordinated level, with the ILO engaged, and we will see how we'll bring this into our ongoing conversation with the World Bank. In terms of the UNDP, we already have that framework that you talked about globally. We've identified the countries where we're going to work together. There will be some, I think there are 3 countries that we've identified as focus countries on different issues. But the work we're doing in the UN country teams, changing the dynamics of how we really deliver as one. And I believe, as my colleague, the gentleman from UNDP, sorry, I forgot the name, the director of the UNDP, oh, sorry, I can't remember the name. The person who spoke after me said that we are—
That's Mr. Stanley.
I knew it was somewhere there. I was having a senior moment. But
oh, wow. Welcome to the club.
As Tan said, you know, we are committed. And where there's a need, where there's a demand, I'm sure we will work to ensure that we respond to that demand. The same way that there's commitment on the part of Madame Ahuna, my counterpart, the Vice President of the World Bank, with whom, the 2 Vice Presidents with whom I'm working with, are that connected. I can assure you there's a shift at that level. And so it's for us to all work together, including with all the partners who are participating in this conversation, to put the pressure on us to make sure that it's not talk. I'm one of those people fed up with talk. Let's move. And when there's a need and you can really articulate it, you can be sure that my team of colleagues who are on the ground will definitely make it happen. So let me stop there. But there's additional information being provided by other colleagues.
Thanks so much. I fully agree. I would just add that even on UNDP side, we have a concrete partnership with the World Bank in 8 countries, including Cameroon, Madagascar, Equatorial Guinea, and others. We're working on a number of issues, including on digitalization. So I think here it's not per se a competition, not at all. There is space because the issue at stake is really big. So we need to work together. We need to join forces. We need to complement each other. I think that's where the challenge is. Identify our entry points and make sure that we actually collaborate to add value, not to compete against each other. That's definitely not what is at stake, because what is at stake is to support member states, is to make those changes. Let's just stop talking, like you said. Let us walk. We need concrete action. And this is why I like the ILO UNDP framework, because it's action-oriented. It's identifying concrete countries, concrete deliverables, and just get it done. So that's really, I think, the kind of change that we need these days. Let me now offer the opportunity to other colleagues to also come in. Just for final remarks, if any.
Thank you. Perhaps I will just highlight 2 issues. One is that the reason why social protection and the provision of social security is a challenge in Africa is that we have a large population that is unemployed or underemployed. And so if we are able to give our people good jobs, decent jobs, then we'll be able to protect them. And so as we look at the social protection and as we promote, we need to also ask ourselves, are we creating enough jobs, decent jobs for our people? And for us to do that, we need to make jobs or labor to be a key component of any discussion that any state in Africa, any agreement Africa enters in anywhere, any policy, even if we are to measure the success of any government or any program, then jobs should be at the heart of that. And then on formalization of the informal enterprise, the key focus here should be about how do we improve the productivity of these enterprises, and how do we link them to the formalized or established supply chains so that they can be able to access the markets and thereby be able to formalize and have offer the social security and social protection that is required. I think for us from Business Africa and from the employers, we need to really be involved in the discussion across Africa and be able to champion for policies and actions that are going to get the people have the jobs. Thank you.
Thank you so much, Mr. Obiro. Very, very useful. May I invite Minister Josué Almeida for any closing remarks?
Allô, bonjour. Merci en tout cas. Oui, Monsieur Ndiaye, merci à tous les participants. Je pense que ces échanges ont été très enrichissants, permettant d'avoir une vue beaucoup plus large sur les approches pour aborder la question du secteur informel et surtout retenir qu'il y a une idée qui m'a paru très intéressante, c'est la collaboration interagences, qui devrait être une approche qui permettrait d'optimiser et de mieux structurer l'appui des partenaires techniques et financiers lorsqu'il s'agit de la protection sociale. Merci donc, et en espérant que ces réflexions vont se poursuivre pour aboutir donc au document d'appui et à l'extension de la protection sociale. Nous remercions également le PNUD et le BIT que je n'avais pas cité, qui a été à l'origine du système, du régime d'assurance maladie qui existe aujourd'hui au Togo. et M. Draman Bachabi qui doit être quelque part en ligne en sait quelque chose. Donc, nos remerciements au BIT pour avoir commencé et au PNUD pour appuyer donc cette phase de couverture des vulnérables et d'expérimentation des mécanismes pour le secteur informel. Le Togo est organisé, engagé dans une feuille de route jusqu'en 2025 qui a pris en compte donc un certain nombre de défis relatifs à la protection sociale et vos appuis seraient toujours les bienvenus. Merci.
Merci beaucoup, Madame la Ministre. Thanks so much. Stan, any final remarks?
Well, nothing much to add to what you already said from the UNDP side. Just to probably restate the fact that social protection is a key component of UNDP's ongoing response to COVID, but we're seeing it not just as part of that recovery response, but as part of defining the post-COVID development paradigm. So, because I mean, these are not initiatives that are going to end with with the pandemic, and this is not the last pandemic we're going to face. So this is a whole resilience agenda. So whatever lessons are coming out of what we are doing, and as part of this partnership, in addition to the 3 countries where we're already to the countries, limited number of countries that have been identified for joint work with our partners, with ILO, with BIGO and others, that there are going to be many other examples coming out of other countries, because there are many countries where UNDP is presently leading recovery initiatives that are connected to social protection, and there will be lessons coming out of those. So we will definitely continue to expand that horizon to make sure that our examples are not limited, and that we can actually contribute to a new phase of sustainability and resilience post-COVID. Thank you.
Thank you so much. Colleagues, I now have the daunting task to deliver closing remarks, but I think with the the rich exchanges that we've had, probably that's not so much needed. I would say first that definitely African countries are trying hard to make progress, but we still have a long way to go. There are huge challenges. Now, this will ultimately be about political will, about partnership, about the ability to bring resources together, to work as one to address this huge challenge that is having an impact on people's lives, that is having a dramatic impact on livelihoods. I do believe that if we all act together in this SDG decade of action, we can change course, we can correct course, because that's what's needed. It's not about us individually as institutions, as governments. It's about the people that we're supposed to support and that definitely need our help. So I'm confident that by joining forces, we'll make the impactful and transformative changes that is expected from us. Colleagues, I wish to thank you, thank the presenters, the interpreters, the participants, the organizers who've worked very hard to make this session happen. I look forward to continuing this conversation. For me, this is just a start. We have an opportunity to transform. So let us make it happen. Let's work. Thanks so much. Thanks, everyone. Over.
Thank you. Bonsoir. Goodbye.
Merci. Au plaisir, Madame la Ministre. Merci beaucoup.
Thank you. Bye.
Thanks, everyone.